Hi, I'm Stephen Cital. I'm an RBT out of California, more recently moved to Maine. And I am the Director of Education Development for Elevet Sciences, which is housed in Maine, and also the co-founder of the Veterinary Cannabis Academy with a good friend and colleague of mine, Liz Houston. I believe the main indications for the use or therapeutic use of cannabinoids in small animals is closely aligned with what we see in human medicine. Certainly, pain is of big interest. We see the use in neurologic diseases, certainly behavioral complications as well, such as anxiety, and certainly things related to post traumatic stress, certainly in animals, especially in animals that may have come from a shelter setting or maybe a more abusive home. I think therapeutic use of cannabinoids is a great indication. When it comes to some of the research behind the use of therapeutic cannabinoids in companion animals, we have had more recently some really interesting studies come out. One of the first studies that we saw come out was certainly the PK study out of Colorado State University, where they used three different dosing methods to see if we can get appropriate therapeutic levels of CBD into a dog, which is important if we're going to be using these things as a therapeutic agent. We also had a study come out from Cornell University where the first part of the study was actually a PK study, again, to test that the body is picking these molecules up appropriately. But then the second part was actually using it to see if we can decrease pain scores in animals with osteoarthritis. And they had great success with decreasing pain scores in aged animals that had radiographically confirmed osteoarthritis. And what was nice about that study is those animals were also on nonsteroidal anti-inflammatories. So as a researcher, as a person that wants a really clean study, it kind of bothered me a little bit because I didn't like that variable in there, but I do think it speaks to the practicality of use in an actual clinical setting because a lot of these animals are going to be on multiple medications at the same time. We also had a study come out of Colorado State University with Dr. McGrath's lab, and her first study was that PK study, as I mentioned, but then she also released a pilot study, which I think was really critical, looking at the efficacy of CBD in particular for decreasing seizure frequency and severity in companion animals. And I believe she's continuing on now with a 3-year-long study at a little bit higher dosing. There's some other interesting data out there in companion animals more recently looking at the use of CBD in horses for allodynia, and certainly describing some of the endocannabinoid system receptors in horses. We also have multiple studies in the works right now, which is really, really exciting with multiple different companies. There is another epilepsy study that's being conducted out of Massachusetts and the University of Florida. There is an acute pain study looking at the efficacy of these cannabinoids for acute pain after TPLO, which I think is really, really exciting, especially for some of these animals that may be NSAID intolerant. We have some other studies that I'm really excited about when it comes to dermatological conditions, in particular atopy in canines, where there's a dermatologist specialty hospital that is actually testing right now the therapeutic use in decreasing pruritus with atopic dermatitis in canines. And there's even some in vitro work looking at the efficacy of these cannabinoids for anti-neoplastic effects, which is really interesting. And I think so far the research is suggesting that there is this thing called the entourage effect, which this conference is going to be talking a lot about, in actually decreasing not only cancer-related symptoms and chemotherapy, but also killing some of these cancer cells, which I think is really, really interesting. Some of the areas I think that are lacking in veterinary medicine when it comes to the safe and effective use of cannabinoids is certainly diving deeper into some of the physiological processes occurring when we are giving animals these particular products. I think what we've seen from some of the literature out there so far and what strikes, I think, the most concern with veterinarians is some of the increases in liver enzymes. And I think what would really kind of make all of us feel more comfortable are longer term studies and actually taking biopsies of the liver to get a histopath view of what's actually happening to the liver while these animals are on these products. So I think that's one area that's kind of lacking right now in the literature. I also am a big advocate for cats. I don't necessarily consider myself a cat person, but I do feel like they get forgotten quite often in the pharmaceutical world and certainly in the supplement world as well. And I would love to see more studies looking at the metabolism, safety, and efficacy of cannabinoids in cats. I think some of the skepticism when it comes to using cannabinoids in veterinary medicine is kind of twofold. So, one, we have this misunderstanding and perpetuation that there is no research from organized veterinary medicine, in particular some of the large associations, when in reality we have thousands of preclinical studies, which include lab animals, which includes dogs and cats in a lot of these studies. And then I think we also have to own up to maybe some of the pretentiousness that we have in America or North America at large with not necessarily accepting studies from other countries. I think we have this bias towards our own studies and we need to repeat everything that is done in other countries, even if that study was a good quality study. I think some of the skepticism isn't necessarily skepticism, but this ingrained bias we've had against cannabinoids and cannabis in general, stemming from the 1930s and the prohibition against cannabis, which started with racism. Let's be honest about it. It was against black people, it was against Mexican people coming in to grow and harvest these hemp plants and these marijuana plants. So I think we have this mix of our own scientific pretentiousness on top of years of prohibition and racism in this particular industry, in this particular product. When it comes to an area in veterinary medicine, I think we need to put a little bit more focus on, outside of some of the studies that I think still need to be done, is certainly looking at how we want to label these products. As an American from the United States, we are in this huge conundrum of what to call these types of products. Should we wait for the FDA? Should we consider it a supplement and a nutraceutical indefinitely? The answer is kind of unclear, but in my personal opinion, I do think there's room for an approved drug from the FDA, and I also think there's room for a supplement or nutraceutical product. And I think that's really going to depend on the indication and the use of these products. I think higher concentration products, higher dosage products might be best as a approved drug, especially if we're going to use it for severe disease conditions, things like cancer and epilepsy, whereas a general health product to support joint function, to support your GI, to support your immune system or what have it, is okay and appropriate as a supplement or nutraceutical product for companion animals. When it comes to the differences between cats and dogs and dosing cannabinoid type products in these animals, I think we need to understand that cats and dogs certainly metabolize botanical products much differently. Some of the preliminary data so far has shown that cats actually metabolize these cannabinoids a lot quicker, so they may need an increased dose or a increased frequency in dosing compared to our dog friends. We also are just at the beginning of understanding what types of metabolites are actually being produced once these products are consumed, at least orally, in cats and dogs. More recently, a researcher, Dr. Joseph Washlag, from Cornell University, who's also the CMO of Elevet Sciences, has done some work, some really interesting work, looking at the stability of these cannabinoids systemically in the plasma versus just what we are giving these animals as far as their stability is maintaining as the original cannabinoid that we dose the animal at. Specifically CBDA, we thought CBDA might bioconvert into CBD in gastric juices because of the high pH, but what we're actually finding is it can actually stay as CBDA and maintain its CBDA form in the plasma.